Our guest today is Dr. Sharona Ross. Welcome back from Advent Health, a surgeon there, and you're talking about the Women in Surgery Symposium.
Yes.
Year number 10, congratulations.
Thank you very much. This is a symposium that started here in the Tampa Bay, St. Pete area back in 2009, and now it's the 10th anniversary, and it became international.
And tell us exactly what it is, what it's directed for.
Sure.
Obviously to get women into surgery, but why is that needed so much?
More than 50% of the medical students are women, but very small number that actually try to get into surgery. And so if you think about it, by 2020 we'll have shortage of surgeons. So we need to truly encourage women to join the profession, which is a very rewarding one. And the symposium also helped those that already chosen a career in surgery to excel in their journey.
So if half of the people entering medical school are women, about
Yes.
Roughly, what did you say, 20% are going into surgery?
No, it's much less, but less than 20% of the surgeons are women. But in general, for women, it's less than 20. I would say even more like 15, 16% that may be choosing, and that's after the numbers have increased.
Okay. And why is that? What are the factors there?
Yeah, apparently we found out that there is a really negative perception among the students, especially in medical school, not from personal experience, but by thoughts by professors and other people that have experienced maybe in the past, that it's a very male-oriented, it's aggressive, you never have time to find a husband or a partner and have kids, have a normal life, which is no longer true. It is still difficult to get into surgery, and the path is not easy, but it's very rewarding. And I have 4 kids, and I have a career, so it's possible. It's just you need to want it enough. And the second problem is that we don't have a lot of mentors, and that's why an event like this is important, because it provides all those young women the ability to find mentors among the community, which mentioned, there are very few women surgeons, and especially now you're asking to women surgeons to come, and the successful among us that I can join and mentor them right. And
you've been into schools as well to help get women on the path there.
That's
I know
right.
there's a STEM contest. Talk about what you do with the
That's
school-age
right.
kids.
So for the symposium over the years, it's been targeting college students, medical students, residents, fellows, and attending surgeons. For the STEM students, those are high school students, but we're trying now to engage them with the most innovative surgical technology that exists, which is with intuitive surgical, the robotic surgery, and then a minimally invasive, most innovative laparoscopic platform that is provided to us by Medtronic and Olympus. And they actually will be doing operations and competing those medical students from the different high schools around the Tampa and St. Pete as well as Clearwater. And then we are hoping that maybe it will spark some interest among those students in surgery, and so they'll be focusing more on getting good grades and really putting their time and efforts into studying. And who knows, by then if it's surgery, that will be great, but if anything, it opens the door to any professional career they might want in the future. And so that's the purpose of us for the second year now in trying to engage high school STEM students.
And we're looking at some of that video of the robotics and you working with some of the younger girls there. What is the generation gap when it comes to women in surgery? I mean, we're Generation X, and we're trying to be mentors to the millennials. That's right.
That's right.
How is that working?
Yeah, so right now, the educators in surgery are the Generation X and the baby boomers, the associate professors, and chairs in programs, in surgical programs. And we are supposed to train now the millennials. There's a real difference in the way that we perceive each other and the way our work culture is. We, the baby boomers and Generation X, don't feel that the millennials are working hard enough, right? But the millennials are looking more to balance what we didn't necessarily do, which is the family and career. They're looking into more quality of life, and I think it's maybe because we pushed all the way to the other side. But in any case, the important thing in this event is to try to identify the differences. We are different. We're all hardworking, because you can't get to this position and not be a hard worker. So to understand what are the differences and then try to find the solutions and respect one another, because we're all in this together, and you know what? The millennials are going to be our surgeons. So we got to train them well.
That's a good point.
That's right.
And we're looking at a shortage.
That's right.
If we don't make that happen.
Absolutely. By 2020, we definitely will be in shortage unless more women are going to join into the field of surgery.
Now, when you started
Yes.
in surgery, what was the atmosphere like for you? Was it almost like, oh my goodness, there's a woman in the room who's going to do my surgery? Did you feel pushback from patients and colleagues, or has anything changed during that time?
Well, that's an interesting question, because yes, in the beginning, I was, as an attending surgeon, I had to dress up, because if I dress with scrubs, they'll think I'm the nurse. And so they're waiting for the doctor to come, or if I was at the VA seeing our vets, who I love, and they would assume that you're the nurse. And they're very nice. They're not trying to be disrespectful. They're just, you're the woman, so you must be the nurse. And I have a medical student with me who's a guy, and they'll keep on talking to the medical students, not assuming that me as a woman would be the surgeon. And so it's very interesting. In more complex operation, they expect more like the guys are going to be the main surgeon. It is changing, but it's a whole social change that needs to happen. And the perception is improving with the more women join a career in surgery.
So tell us about the symposium. If someone's listening and thinking, I either work in the field of surgery and I would like to help mentor or learn more, or if you're young and you're considering it as a career choice.
That's right.
What do they need to know to take part?
Oh, that's very easy. All you need to go is to the women-in-surgery.com and register. The sooner the better, because the space is running out, and this is an amazing event. We're bringing women from all around the country, very successful women surgeons who are going to not only tell them about their career obstacles or any challenges and how they resolve them, but also guide the young ones as to what's the best steps to take. And we have workshops which are divided between residents and students, to fellows and attending. So according to their stage in their career, they'll have the topics that they would be listening to. Then a plenary session talking about the future of healthcare, and panels about balancing career and family and all that.
We all
That's
deal
right.
with.
But how to create your voice, how to maintain it strong. I mean, there's a lot of very empowering topics for women, and so it's interesting, in fact, to all professional women. If you sit there and you just listen, we all have the same issues in all of our professional environments. But for women in surgery who might be interested in surgery, that's the best event to come and find mentors, because the best of the best are in that event.
Excellent. All right. Well, Dr. Ross, it is Friday, so
Yes.
thank you very much for coming to tell us about it. We appreciate it.
The pleasure is all mine. Thank you.